my name's Anna. I'm going to be doing your assessment today.
All right, my name's Dan.
All right, sounds good. So we're going to get started with your hair and your scalp. So I'm going to take a look, okay?
All right.
So during this assessment, I'm going to be taking a look in your eyes, in your ears, up your nose, in your mouth, and I'm going to be listening to your heart and lungs. Does all that sound good to you?
Yep, that's fine.
Just going to feel around here. Do you have any tenderness?
Nope.
I don't feel any bumps or any, I don't see any skin lesions. Any tenderness in your face here?
Nope.
Alright. So I'm going to just look at your face here. It looks pretty symmetrical. Can you smile for me? Okay. Can you frown? Can you raise your eyebrows? And shut your eyes really tight? And puff out your cheeks. Okay, good. So everything, all that movement is symmetrical. That's your facial nerve. Now I'm going to feel your pulses here. Temporal artery. They both feel regular, +2. And then I'm going to take a listen. Okay, and I don't hear any bruise, which is good. So next we are going to test your facial sensation. So I'm going to use this pen cap here, and there's a dull side and then a sharper side, so I'm going to show this to you on your finger here.
Okay.
Okay, so I'm going to have you close your eyes, and then I'm going to touch this to your face and tell me if it's dull or sharp.
Okay. Dull. Sharp. 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 Dull. Sharp.
All right, very good. So now I'm going to test your eyes. So this is my little eye chart here. I'm going to stand about 6 feet back, and I want you to cover one eye for me, and then I want you to read the smallest line that you can read from there.
L T F P H.
Okay, and now cover your other eye, and can you read the same line starting on the other side?
H P F T L.
Okay, very good. And that is checking your optic nerve, which is intact. So next I'm going to be doing the rest of your eye test. So I'm going to look at your pupils here. So if you want to look just straight ahead at me. Okay, and your pupils are both round and reactive to light in the same way. So now I want you to look over my shoulder, and I'm going to put my fingers in front of your face, and when I say go, I want you to look at my fingers, okay? Go. Good, and we want to see that pupil constriction there. And now I want you to follow my fingers with just your eyes and keep your face looking towards me. Good, so those eyes are testing the abducens, the oculomotive, and the trochlear nerves, which are all intact.
Okay.
So now I'm going to be looking at the structures of your eyes here. If you'll look forward for me. Okay. Good. That's just the cornea, it looks clear, and then your sclera looks white, which is what we want to see, and your eyelids come over your irises, but not your pupils, which is good. If you'll close your eyes for me, I'm going to touch your eyelids, okay? So they feel firm, but not hard, and there's no nodules, which is good. You can open your eyes, and then I'm going to pull down your eye a little bit here. We'll do your conjunctiva, which is pink and not red. I don't see any swelling or excessive tears. Do you have any pain right here?
Nope.
Okay, that's good. And now I'm going to look in your eyes here. Just look forward for me. Okay, very good. I'm looking for the optic disc there, and it's got sharp and defined edges, which is we want to see, and no other color abnormalities here. So just look for same as before. Okay, very good. And those are the same on both sides there. So now we're gonna move on to your ears, and they look symmetrical. They line up with the tops of your eyes there. I'm just gonna touch both of them here. Do you have any tenderness?
Nope.
No. What about back here?
Nope.
Okay. And the cartilage is firm but not hard. So now I'm gonna look into your ears here. Just look forward for me. So here I'm looking for the tympanic membrane. It should be pearly gray, which it is. And then I also see the internal structures such as the cone of light and the umbo. And do the other side here. Okay, that side looks good as well. So now we're going to move on to your hearing test. So this is a tuning fork, and I'm going to make it have noise, and then I'm going to put it on the top of your head, and I want you to tell me if you hear or you feel the vibrations in one ear more so than the other.
Okay. The same.
The same. Okay, and then I'm going to do the same thing, and I'm going to put it behind your ear right here, and I want you to tell me when you can't feel the vibration anymore, and then I'm going to put it right in front of your ear, and I want you to tell me when you can't hear the sound anymore, okay?
Okay. Okay.
Okay.
Okay.
So what we want to see there is that the air conduction, which was the second one, is over twice as long as the bone conduction, which was the first one, which it was. So now I'm going to stand behind you, and you just go ahead and look forward. I'm going to say 3 words and letters together, and I want you to repeat them after me, okay?
Okay.
9x2.
9x2.
Okay, and then on the other side.
4b6.
Good. And those tests are to test your vestibular cochlear nerve, which is intact. Alright. And now we are going to look at your nose. So I'm just going to touch your nose here. Seems to be straight. Do you have any tenderness here?
Nope.
No? Okay, and your nares look symmetrical. They're both oval. And then I'm going to take a look inside your nose here. Okay. Touch it up a little bit. Okay, that's good in there. Your septum is symmetrical. Alright, and now I am going to look inside your mouth. So your lips look pink and dry, so that's good. And then if you just open your mouth for me, I'm going to look inside here. Alright, everything's looking pink and moist, which is what we like to see. And your teeth are intact and straight. Do you see dentists regularly?
Yep.
Okay. Alright, I'm just going to have you open your mouth so I can look at the back of your throat. Okay, and say ah for me. Good. And that one is the glossopharyngeal nerve that's intact. And I'm going to assess your trigeminal nerve, so I'm going to place my hands on your jaw, and I want you to clench for me. Good. And now can you open your jaw? Okay, and close it. Good. Good. Alright. And next we're going to do your lymph nodes. So I'm going to come around and touch the back of your neck. Those are the occipital lymph nodes, and then the postauricular lymph nodes. Let me know if you're having any tenderness with this, okay?
Okay.
Preauricular nodes, submandibular nodes, submental nodes, tonsillar nodes, your post-cervical nodes, your superficial cervical nodes, your deep cervical nodes. Move your gown here. These are your supraclavicular nodes. Do you have any tenderness with any of those?
No.
Okay, I didn't feel any enlargements or nodules or anything like that, so that's good. And then your neck looks symmetrical. Just gonna feel for your trachea here. Yep, midline. Okay, and I'm gonna come around the back here, and I'm going to palpate your thyroid gland here. So just keep looking forward for me. Push her to the side. Do you have any tenderness here?
No.
Okay, can you swallow? Good. We'll do the other side. Okay. Any tenderness?
No.
Can you swallow? Good. And I don't feel any enlargements or nodules there either. Then can you tilt your head back for me all the way, and then tuck your chin to your chest? Good. And then can you turn your head this way for me, and then press against my hand? Good. And then the other way, press against my hand. Good. Can you shrug your shoulders for me? Good. All of that's testing your accessory nerve, which is also intact. And then I am just going to feel for your carotid pulse here. Okay. Take a listen. Okay, so they feel and sound regular, and I don't hear any breweries, which is good. So now we're going to move on to your respiratory assessment. So I'm going to start in the back here. Okay, and I'm just going to watch you while you breathe for a couple times. Good. And then I'm just going to touch you on your back to see if I feel any lumps or masses or any crepitus back here. Do you have any tenderness here?
No.
No? Okay, I'm going to place my hands on your lower back while you take a deep breath in. Good. So your breathing is symmetrical here. Good. And then you can just breathe normally. I'm going to be tapping on your back, okay? And for that, I'm just looking for different sounds over your ribs and over where your lungs are.
Okay.
So we're going to hear a dollar sound over the ribs and more of a resonant sound over your lungs.
Okay.
So now I'm going to take a listen here. I want you to take a big deep breath every time I move my stethoscope. So up here we're hearing some bronchovesicular sounds. And at the bottom we're hearing the vesicular sounds. So I'm going to place my hands on your back, and I want you to repeat the number 99 for me.
99. 99.
Good. And I'm just looking for the vibrations as we go down. Those should decrease. Okay, and now we're going to do the front. So if you don't mind taking your gown off here. All right, we're going to do the same. I'm just going to watch you breathe first. Good. I'm going to place my hands here. Go ahead, breathe again. One more time. Good. So breathing symmetrically here, and I'm just going to feel for the same lumps and masses and crepitus as I did in the back. Okay, everything looks good, and I'm going to feel on your sides here too. I'm going to do the same tapping thing that I did in the back on the front here. listen to you here. Okay. I'm gonna listen to your throat first through your trachea, and that one is gonna be bronchial sounds.
Okay.
Okay, and then next we're gonna listen to your chest, and the top's gonna be bronchiovesicular sounds. And now we're hearing just vesicular sounds. Okay, and if you will put your hands up for me, we do both at the same time, and I'm gonna listen to your sides, which should also be vesicular sounds. Okay, you put your arms down. And then we're gonna do the same thing. I'm gonna put my hands on your chest, and you're gonna repeat the number 99.
99, 99, 99, 99.
Good. Okay. And then I'm just gonna take a look at you from the side here for your diameter of your chest, which looks to be about 8 or 9 inches. And then now I'm just gonna be taking a listen to your heart, so if you don't mind laying down for me. Okay. And can you put your hands to the side? I'm just looking for your heartbeat in your chest here. Okay, and then I'm gonna place my hand here to feel for your heart rate. Okay. This is called your point of maximal impulse. And I don't feel any adventitious signs either. So I'm gonna go to the other side here. And then will you turn your head to the left? And I'm just gonna feel your pulse on your neck here as well. And they are equal at the same time. And then while you're laying like this, I'm just gonna look at your neck here, and I don't see any bulging of your veins with your pulse, which is good. And then I'm gonna take a look at your other side. You turn that way. Good, I don't see any there either. So now I'm gonna take a listen to you. We're gonna start while you're laying down. This first area is the aortic valve. The second area is the pulmonic valve. And here we have the tricuspid. And the mitral. Okay, I'm gonna have you lay on your left side. And then I'm gonna take a listen over here as well. Okay, and if you'll sit up for me, I'll take a listen while you're sitting as well. all sounds very regular. So that's all I have for you today. Do you have any questions?
No questions, thank you.
Yeah, no problem.